Hello, everyone. Good afternoon, good morning, good evening from wherever you are. My name is Dr. Amit Abraham, and welcome to another session of Health and You. So, a little bit about the Health and You Community Wellness series before we begin. So, the overall aim of the series is to try to raise community awareness about health and disease, with the ultimate objective being to enhance self care, reduce suffering, improve quality of life, and increase healthy longevity. Please note that this series is aimed for the general public. It is not a CME CPD activity, and there will not be any CME CPD points being given at the end of the session. We have a wonderful speaker today, Dr. Tariq Chukir, who is an assistant professor of medicine here at Weill Cornell Medicine-Qatar. And he is going to be talking about metabolic health in Ramadan. And I'm going to very briefly read his intro. Dr. Tariq Chukir is a clinical educator here at WCM-Q. He practices endocrinology and obesity medicine at the Qatar Metabolic Institute and at Sidra Medicine. He is actively involved in undergraduate and postgraduate medical education and conducts clinical research in obesity and metabolic health. Dr. Chukir has authored several peer-reviewed publications and book chapters in the field of obesity, and he serves on multiple committees at local, national, and international levels. So, Dr. Chukir, we are very happy and pleased that you're here, and the floor is yours.
Thank you, Dr. Abraham, for the introduction. Thank you, everyone, for joining. And the talk is in line with the objectives for the Health and You series. I have no financial disclosures to make. Let me start by doing a poll to get your understanding of what metabolic health, what it means to you. To answer, please scan this QR code, and then it will ask you to type what you're in your mind. What does metabolic health mean to you? As you guys can see, metabolic health sounds very scientific, but it may mean different things to different people, whether people in the community or even people in the medical field. So it's very important to have a clear definition to what metabolic health is. In adult, it means something different than what is referred to in childhood. Frequently, when people talk about metabolic health in childhood, they're referring to inherited disorders of the metabolism. In adults, we're typically referring to metabolic disorders. To me, a metabolically healthy individual is an individual who does not have metabolic disorders that predispose to cardiovascular events or premature death. What are the metabolic disorders? The metabolic disorders are type 2 diabetes, high cholesterol, obesity, high blood pressure. Okay. And the reason we care about them, because having them predispose to other complications, such as cardiovascular complications and premature death. When these conditions occur in clusters of 3, it's called metabolic syndrome. So metabolic syndrome includes 3 of these 5 conditions: abnormal cholesterol, elevated blood sugar, high blood pressure, excess weight. What these share in common is the mechanism, insulin resistance. I have another poll for you. Is insulin resistance a disease? Insulin resistance is becoming very popular. We hear about it all the time, whether in the community, social media, or clinics. Let me ask you whether you think insulin resistance is a disease or not. Perfect. So I can see that we're split, but the majority believes that insulin resistance is a disease. Let me begin by explaining what insulin resistance is. In a normal individual, glucose and other metabolites are maintained within normal limits using hormones. One of these hormones that regulate glucose is insulin. So insulin is one of the key hormones that maintain normal glucose levels in the blood. Insulin helps tissue and cells to take up glucose. These tissues are in the liver, muscle, or other organs. When insulin resistance exists, the cells become resistant to insulin. They need higher levels of insulin to be able to control the glucose or the sugar level. Insulin resistance may occur due to many factors. It can be obesity, it can be inflammatory states, or it can be other genetic factors that contribute to insulin resistance. Insulin resistance is a mechanism that lead to other disorders. So by itself, it's not a disease, but it does lead to other disorders. It's the main underlying mechanism in the pathogenesis of type 2 diabetes. It's the main driver of type 2 diabetes. Uh, there are signs that suggest insulin resistance. For example, when we see darkening in the skin, in the neck, for example, it's called acanthosis nigricans. These are signs of insulin resistance. And when this comes up, we try to assess for diseases like type 2 diabetes and others. Um, when people ask about insulin resistance and they ask to be checked for insulin resistance, a common test that's commonly ordered is the HOMA-IR test. HOMA-IR is calculated from fasting insulin and fasting glucose over 405. You'll get a number and it will tell you whether you have insulin resistance or not. The guidelines, most of the clinical guidelines, do not recommend using HOMA-IR or insulin levels routinely to assess insulin resistance. And the reason they do not recommend assessing insulin resistance using insulin levels is because the tests are not accurate. They do not perform well. I'll give you the analogy of basketball. If you have someone who's not good in basketball, and the test here is the player who's not good at basketball, the likelihood that they will miss is high. The same thing with a bad test. If you have a bad test, the likelihood that they will get you the right number is low. And if the test gets you the right number, you're not sure whether it was done by luck or due to the test performance. So that's why the guidelines do not recommend routinely assessing for insulin resistance using HOMA-IR, because this test itself is not very accurate. We do it in research settings to get an idea about what's going on, but it's not a very accurate test to rely on. I do not have strong opinions about it. The use of HOMA-IR in practice can be beneficial or can be harmful. It can be beneficial to incentivize people to adhere to healthy lifestyle. For example, if you calculate the HOMA-IR and it turns out to be elevated, and then the individual looks at the number, sees the elevated HOMA-IR, this might be an incentive to engage in healthy lifestyle. And in that case, it might be beneficial to do the test. But it may also it may be harmful in certain settings. For example, you may do the test. You may get people to focus on numbers without really focusing on what matters the most, and it may create anxiety just uh, by sharing like an abnormal number, but you're not sure whether it's accurate or not. So it might be harmful in that regard, where it creates unnecessary stress about a lab test. So we discussed what I mean by metabolic health when I'm referring to metabolic health. Metabolic health might come up in different settings. It may come up in social gatherings, it may come up in clinic, it may come up in social media. My advice to you is to be clear with regard to metabolic health. Remember the different components, identify a specific problem, and know what the goal is. If the goal is health in general, which was mentioned earlier in the poll, then our primary goal is prevention of disease. And if the goal is to treat a problem, then we need to be specific. Okay, what's this problem? Is the problem diabetes? Is the problem hyperlipidemia? Is the problem hypertension? Is the problem obesity? And then we should holistically address this problem specifically, because there is no one size fits all with regard to problem treatment. And we do not have a magical pill that will solve everything. So my recommendation is, what do we mean by metabolic health? Be specific and then take it from there. Okay. The first step is to know when to look for metabolic problems. So when should we screen for metabolic problems? For diabetes, for example, the guidelines vary, but in general, it's recommended for people who are 35 or older because age is a risk factor for developing diabetes. The older you are, the higher the risk factor, the higher the risk of developing diabetes. Um, in addition to age, if someone has other risk factors, let's say obesity, smoking, polycystic ovarian syndrome, history of diabetes during pregnancy, or other risk factors for diabetes, then it's important to be proactive and do a blood test to screen for diabetes. If the tests are normal, we typically recheck in 3 years. But if the results came back borderline in the pre-diabetes range, then we repeat the test every year to make sure there is no progression to diabetes, and hopefully there will be progression to the normal diabetes range. So with regard to diabetes, we look for it in people 35 or older, or in younger individuals who have risk factors for diabetes. Blood cholesterol should be done in every adult, and it should be done every 5 years if it's normal. Blood pressure is typically done routinely when you go to see your family physician or your primary care physician. So at least during your annual health visit, blood pressure should be checked to make sure blood pressure is under control. If blood pressure is elevated in clinic, then we typically ask people to check their blood pressure at home, come back to clinic with their blood pressure cuff, and then in clinic, we check their blood pressure with their home machine as well as with the hospital machine to compare the readings and validate the readings that they're getting at home. Okay, so we talked so far about how to screen for diabetes, how to screen for cholesterol, how to screen for hypertension. Let's move on to talk about obesity. For so many years, we've relied on the body mass index, which is weight over height square. It's important to realize that body mass index has limitations. Body mass index is the weight over height. It does not differentiate between lean versus fat mass. For example, if you have someone who has a higher weight due to a muscle mass, their BMI is going to be elevated without having excess fat. So you may get a misdiagnosis, false positive result in this condition. It's easy to pick in clinic just by history and by observing the individual. People with muscular habitus are likely to have higher BMI without having high fat. The issue is some people might have lower weight, and when you calculate their BMI, you calculate their weight over height square. Their BMI may not be in the obesity range, but even at lower weight, they have higher fat mass. And they do have excess adipose tissue or fat mass. And we see this in the Asian population and the Middle Eastern population. So some people might be a bit missed with BMI. The other limitation of BMI is that it does not tell us anything about fat distribution. We know that visceral fat, the fat that deposits around organs, is more harmful than subcutaneous fat. BMI will correlate with the total body fat, but it does not tell you much about where fat deposits. To address these limitations, many guidelines are recommending complementing BMI with other anthropometric measures, such as waist circumference or waist to hip ratio. This is from the American Association for Clinical Endocrinologists obesity algorithm that was published within the last year. and they do recommend complementing BMI with waist to hip ratio when excess adiposity is not very clear. And what's nice about this algorithm is that they recommend ethnic specific cutoffs. For Middle Eastern, for example, um, these are the cutoffs in centimeter for both male and female. The nice thing about waist to hip ratio is that the number is the same for different ethnicities and for males and females. So what we covered so far, we covered what we mean by metabolic health. We covered how to screen for metabolic health. Let's now move on to discuss strategies to optimize metabolic health in an individual, and we'll discuss the role of fasting here as well. As I mentioned earlier, it's very important to know what the goal is. If an individual does not have a disease, does not have a metabolic disease, and the goal is to prevent diseases, the strategy is healthy lifestyle. There is no need for supplements, there is no need for medications. Healthy lifestyle is very effective to prevent diseases. Okay? Healthy lifestyle can mean different things, but the 3 or 4 main components are sleep, physical activity, healthy eating, and stress management. I'll begin by discussing sleep. And the reason I decided to begin with sleep because it's very important and it's typically ignored. I see many people in my clinic, many adolescents, unfortunately, who are 14 years old, who are coming in with significant obesity. And then when I take history from them, I realize that their sleep cycle is completely disorganized. They sleep at 12, 1 a.m. They wake up at 6 a.m. for school. They go to school, they come back, they nap for 2, 3 hours in the afternoon, and the same recurs every day. Sleep takes up 1/3 of our day, and important metabolic processes occur while we're asleep. What is sleep insufficiency? Sleep insufficiency is sleep that's insufficient to support adequate performance and health. It can be defined by decreased quantity, where people are not sleeping enough, or it can be defined by decreased quality, where an individual's self-satisfaction with all aspects of sleep is decreased. Sleep can be either impaired by quantity or by quality. It's important to differentiate between chronic sleep insufficiency versus insomnia. People who are sleep insufficient, if they're given the opportunity to sleep, they will be able to sleep. In contrast, people with insomnia, even if they're given the opportunity to sleep, they will not be able to sleep. How much sleep do we need? It varies from an individual to another, but in general, younger people need more hours of sleep compared to older individuals. But if we look at adults between the ages of 18 to 64 years, somewhere between 70 to 9 hours is what's needed for the majority of people. Okay. Why is sleep important? So many of the metabolic processes occur during sleep. There is significant association between sleep and metabolic disorders. For example, there is strong association between sleep and diabetes, and the association between sleep and diabetes is U-shaped. What it means is that if you sleep too little, you're at higher risk of diabetes, and if you sleep too much, you're at higher risk of diabetes. The sweet zone is here, which occur at around 7 hours of sleep per day. So if you sleep around 7 hours per day, your risk of diabetes is lowest. But if you sleep more than 9 hours or you sleep less than 6 hours, then you have higher risk of developing diabetes. Not only quantity, but also quality has been associated with the risk of type 2 diabetes. People who report poor sleep quality are at higher risk of developing diabetes compared to those who are satisfied with their sleep quality. The other thing that we're learning more about is chronotype, which means which refers to when you sleep. It seems that those who tend to sleep late, even for enough quantity, but they start sleeping late, they have worse outcomes than those who go to bed early and they sleep for 7 to 8 hours. Many clinical guidelines are recognizing the importance of sleep and they are recommending it to patients with diabetes. Here is a recommendation from the American Diabetes Association and the European Association for the Study of Diabetes, highlighting sleep as a central component in the management of type 2 diabetes. We talked about the association with sleep and diabetes. Let's move on to discuss the association between sleep and obesity. I gave you an example from clinic, but this comes up very frequently. I see people with obesity primarily, and sleep commonly comes up as an issue in these individuals. So reduced sleep duration has been associated with higher risk of obesity. Those who sleep less end up consuming more calories. When they don't sleep well, they tend to eat during late hours and they have a preference for high calorie foods. And many of us who have been at some point in their life sleep deprived, they can relate to this. When you're sleep deprived, I remember this from my cold days during residency. So when you're sleep deprived, you tend to prefer high calorie food and you tend to prefer to eat later at later hours. How does sleep affect obesity? Through different mechanisms. This is a nice study that looked at changes in satiety and hunger hormones with sleep. And what you can see here, ghrelin, which is the hunger hormone, it's the hormone that makes you feel hungry. When you sleep less, you can see when you sleep less hours, your hunger hormones are higher than when you sleep 7 to 8 hours. The opposite is accurate for the satiety hormone. So leptin is the satiety hormone, is the hormone that makes you feel full. And you can see the more hours you sleep, the better the leptin levels, the better the satiety hormone. Okay. So now we discussed the first component of healthy lifestyle, which is sleep. Let's move on to discuss another central component of healthy lifestyle, which is healthy eating. If I may ask you to scan the QR code and tell me, what do you think is the best diet? Yeah, I see Mediterranean. Anyone else? Maybe try to scan the QR code. High fiber diet. Balanced, good. Keto, portion control, good. The diet that can be maintained for a long time. Whole grain, plant-based. Perfect. Okay. You guys are all right. So the best diet is the diet that you can adhere to. There are many diets that are considered healthy. The best diet is the diet that you can adhere to. Okay. There are, again, many dietary patterns that can be followed. What really matters is to think about the components of healthy diet. What define healthy eating habits? One important thing is avoiding and decreasing the amount of ultra-processed food, the food that went through processing to come to you, and focus on whole grain food. You will be surprised how abundant ultra-processed food is. We should try to rely on food that come from natural sources, whole food, and so on. Even things as simple as bread can go through significant processing. This is an example from Qatar. So you can see this toast. This is for bread, and you can see how many components it has. When you see the letter with numbers, uh, it suggests that preservatives are added, chemicals are added for simple bread. You don't need a lot of ingredients to make bread. You can make bread with three, four ingredients. So it's very important to look at the ingredients, look at the label, make sure that the food is coming from whole food sources. Try to avoid things that have a lot of preservatives, chemicals, and rely on things that come from natural sources and are simple in ingredients. Um, the issue with snacks that are rich and let's say candy bars, chocolate bars, the issue with them is that they're ultra processed and they're very high in sugar. So when it comes to healthy dietary patterns, we should aim to decrease the amount of ultra processed food, focus on whole food, have food that's low in added sugar. When it comes to carb, focus on on the whole grain carbs, which are rich in fibers and other nutrients. Try to decrease the amount of refined carbs, the white flour, white rice, and focus more on the whole grain carbs. And focus on the lean protein. Protein is important to preserve muscle mass and to present and to build muscle mass. So based on these key rules with dietary patterns, there are different dietary patterns that can be followed that are considered healthy. Fasting is a form of eating where an individual alternate between periods of fasting and eating. There are many forms. Here are some examples of fasting: alternate day fasting, where someone eats for one day and fasts for one day, and they alternate. 5-2 fasting, where 5 days per week, an individual uh, follow an ad libitum diet, where they eat what's a typical diet is for them, and then 2 days per week they calorie restrict. This is very similar to the Islamic Monday and Thursday fasting. Time restricted eating or feeding is when someone fasts for a number of hours per day and eat for a number of hours per day. An example is the 16-hour fast, where people fast for 16 hours and they eat for an 8-hour eating window. Ramadan fasting is a form of time restricted feeding. So in Ramadan, you fast for 30 days, depending where you are. But here in Qatar, let's say you fast for approximately 12 hours, and then the eating window is 12 hours. But it's a form of time restricted eating. One of the issues that we face in this obesogenic society is that we eat for so many hours. We have data from smartphone apps, and what we can see is that the median eating hours is 15 hours per day, which is a lot. The rationale behind following fasting is metabolic switch. So when you fast for more than 12 hours, this is when your body switches from relying on glucose, on sugar made by the liver, to uh, to 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 oxidize fatty acids, make ketones, and utilize the fatty acids that our body have. And this is what we call as the metabolic switch. Let's now move on to discuss health benefits of Ramadan fasting and other forms of fasting. There are many studies on Ramadan fasting, more than 100 studies with mixed findings. It's not surprising for people who observe Ramadan, because the way people behave in Ramadan is very heterogeneous, is very different. So some people may follow a healthy lifestyle during Ramadan, others may fast, but every other component of healthy lifestyle is affected negatively. So some people may fast during Ramadan, but their sleep-wake cycle is flipped. They're not exercising, and they're not focusing on high-quality food. Others, uh, others are still maintaining their sleep-wake cycles. They still exercise and they follow high food quality while they're following fasting. But that's why data on Ramadan fasting is very heterogeneous because people do different things. But in a meta-analysis, which is a study that pools the results from different studies, in this case, they pulled results from 91 studies involving more than 4,000 adults who fast Ramadan. They found in response to Ramadan fasting compared to controls, there is improvement in cholesterol, improvement in blood pressure, improvement in sugar. It's important to remember that some people have medical conditions such as diabetes, heart disease, chronic kidney disease, and it's very important to seek their provider's advice before they fast. For example, in the endocrine world, if I have someone with diabetes, it's my responsibility as a physician to work with the patient on whether Ramadan fasting is safe for them or not. There are many elements that we take into consideration to make this decision. One helpful tool is the DAR risk assessment tool, which takes into consideration four factors. We look at whether the patient has diabetes and is pregnant, what type of diabetes they have, for how many years did they have diabetes, how is their diabetes treated, do they have hypoglycemia, low sugar, how well their diabetes is well controlled, and other factors. And this will give us an idea about the risk of fasting. Based on the risk, they can be low risk, moderate risk, or high risk. And then based on the risk, we can have a discussion about what the best next step is. So the message here, if someone has diabetes or other medical conditions, it's very important to seek medical help to determine how to optimize their fast in a safe way. Let me now tell you briefly about the 16-hour fast, time-restricted eating. Many people who follow this form, their main objective is to lose weight. And this study tried to answer this question by looking at people who have obesity, excess weight, who would like to lose weight. They divided the groups into two groups. One group followed calorie restriction, around 500 calories restrictions per day, either through time restricted eating or through conventional dieting. And what they found is that when you calorie restrict using time restricted eating versus conventional dieting, they're both effective intervention to achieve weight reduction. So people who followed either conventional dieting or time-restricted eating, the 16-hour fast, they lost approximately 9 kilograms, approximately 7% total body weight. So if someone weighs 100 kilograms, they would lose around 7-8 kilograms from fasting. And this is what we see with behavioral modification. When people follow behavioral or healthy lifestyle to lose weight, they lose on average between 5 to 10% total body weight loss. So we saw this with time restricted eating, we saw this with alternate day fasting, and it seems like it does help people to lose somewhere between 5 to 10% on average. Some people lose more, some people lose weight. So whether it's an effective intervention for weight management, it seems like it is effective for weight management. The question is whether it's a good choice for the individual. It may work with some people, others may not tolerate fasting and may not be able to adhere to it. So the final recommendation is individualized based on the individual we're working with. There is another form of fasting, which is the 5 to 2 fasting. Again, like very similar to the Monday and Thursday fast. So when people follow 5 to 2 fasting, 2 days a week, let's say Monday and Tuesday, they consume 25% of their calorie needs. So caloric restriction 2 days a week, and then their calorie needs on the rest of the days. And then when we look at the effectiveness of this fast compared to placebo or conventional dieting, we can see that this form of fast is effective, and it is as effective as conventional dieting, and it's better than control groups with regard to weight loss. We hear a lot about other benefits of fasting, such as longevity, anti-cancer effect, and these are likely mediated through autophagy. So autophagy is a cellular process that removes damaged protein, organelles, DNA, and this is the mechanism that's thought to confer the longevity benefits in these individuals. But these are things that have been seen at a cellular level. To see it clinically, to see it in an individual, it likely require long-term adherence, which is very hard to assess in the real-world setting. This is a study that was published just a few days ago in Cell Metabolism, and they found that 16-hour fasting optimizes immunotherapy response in mice and humans. Immunotherapy is a treatment for cancer. The way immunotherapy works is that it modifies or it pushes the immune system to fight cancer cells, and it's really effective for certain cancers. Here they assessed the efficacy of fasting in both mice and human cells, and they found that fasting improves response to immunotherapy by modifying the tumor microenvironment, by modifying the immunity, to make the immune system more effective in fighting cancer cells. So again, like this still need to be studied further. It needs to be translated into clinical studies. But from this basic science studies, it seems like fasting might play a role in individuals with cancers. But we need more studies because the decision is complicated. People with cancer may have decreased appetite. They might be losing weight. They might be losing muscle, sarcopenia, and fasting may make this worse. So it's very important to not apply it to everyone, individualize it, and wait until we have well-designed, powerful studies available. So we talked about sleep, we talked about healthy eating, and we talked about fasting. Let's move on to talk about exercise. When we look at the proportion of individuals who are meeting the exercise recommendation, it's very low. Probably less than 20 or 30% of people are meeting the exercise recommendation. What's recommended is that people should engage in 150 minutes per week of moderate intensity exercises, which is brisk walking, jogging, swimming, biking, which translates into 30 minutes per day for 5 days. Or people can do a more vigorous exercise for shorter duration, 75 minutes per week. And it's recommended to add resistance training, muscle strengthening training, at least 2 days per activity. So this is the goal that people should try to aim. Of course, we do not get there from day one. It's very important to take a step by step. Start by increasing activity and gradually build over time. We should do better with exercise. What I tell people in my clinic, I see a lot of patients who come to see me for obesity management. A lot of them have obesity-related complications. A lot of them are being initiated on obesity medications to help them treat obesity and treat the associated complications. And we always discuss lifestyle as an adjunct. And I try to encourage them like to engage in physical activity, not just for their health, but also for their kids. When they what I do is I try to incentivize them to be a good role model for their kids, because when people not only for their kids, for people who they're working with, for people who they're friends with. It can have a positive peer impact on the society. Um, so I try to encourage people to exercise, to be good role models to everyone. It requires investment, just like how we invest in education. It's very important to invest in our health. Exercise may not be easy to do. So some things are easy to do, but others will need to be trained. And I encourage particularly younger people to invest in exercise, to hire a trainer to teach them how to do resistance training. It's very hard to do resistance training without background. So I encourage them to hire a trainer. If they cannot, they can watch videos on YouTube. And there are different forms that can be done. If people do not want to carry weight, they can do bands, they can do swimming with resistance. So there are different options that can be followed. If someone does not like one form of exercise, I'm sure there's a form that will suit their preferences. Okay. The last section that I want to cover before I end is to talk about supplements that are commonly promoted commercially for metabolic health. Here are some general rules about supplements. In medicine, in academic medicine, we're trained to give a diplomatic answer when it comes to most of the supplements. So most of the supplements we cannot recommend for or against for the following reasons. People like supplements. The reason they like supplements because they are natural, they come from natural sources. The reality is they're not natural. They went through processing to be delivered to you in the form of tablets. Some of the medications also come from natural sources, but they go through processing to come to you in the form of tablets. So they're not truly natural. They went through processing. The difference between supplements and medications is that medications are very tightly monitored. The production of medications is very regulated. It's not the same for supplements. It is not tightly monitored, and you will be surprised by how easy it is to produce a supplement and sell it. Some of the supplements may have studies that support their use, but remember that even if studies exist, they're generally weak in most cases. There might be some exceptions, but in general, data for supplements is very weak. They're either done on a few patients, so the sample size is very small. There's no comparison, so I don't know whether the benefit is seen because of the supplement or something else. And they're short term, they're typically for a few weeks, not long term. If someone is going to use a supplement regardless of our recommendation, then my advice is look at the bottle and make sure it is verified by a third party. So there are companies that will verify the component of the supplement. So make sure if you're using a supplement, use a supplement that is verified by a different company. And this is usually stated on the supplement bottle. Okay. I recommend against the use of supplements with mixed ingredients. When you see a bottle that has the supplement, the metabolic benefit supplement, the weight loss supplement, the fat burning supplements, they usually have a mix of stuff. And I worry about their outcomes. I've had patients who took fat burning supplements who developed palpitations, heart racing. So I wonder what's this supplement contaminated with, what's added to it. So I would be very hesitant with combination supplements. Okay. Berberine is a supplement that is increasing in popularity. So many people are asking about it for glucose improvement, for diabetes, for insulin resistance. I looked at the studies. Some of them show benefit, but they're short-term studies. The reason I hesitate to use it as a first line in my clinic, because for diabetes, we have great medications that are very well studied, very well monitored, and have a multitude of benefits. The current medications that we have for diabetes can be beneficial not only for glucose control, for sugar control, but can be beneficial for weight management, can be beneficial for heart disease risk reduction, can be beneficial to protect the kidneys from progressing to kidney failure in people with diabetes. So that's why, like, I'd rather use medications with studies that strongly support their benefit versus a supplement that's weakly studied, and the magnitude of benefit is no close to the medication. And there are many other supplements that I'll skip for now. So to summarize, be a role model for a healthy lifestyle. Sleep is important. Prioritize exercise, invest in exercise. Healthy eating can mean a lot of things. There are many options. Focus on avoiding ultra processed food, rely on whole food. When it comes to carbs, decrease the amount of added sugar. Focus on complex carbs, less refined carbs. Focus on lean protein. And these interventions are generally enough to prevent metabolic diseases. Listen to information from trusted sources. Uh, if someone has a metabolic disease, then the best thing is to see a specialist so that they can receive individualized, person centered care for their condition. Thank you, everyone, for listening, and I'll be more than happy to take any questions that you may have.
Thank you very much, Dr. Tariq, for that very interesting introduction into the topic. And I think there were lots of very useful tips for our audience, practical tips that they can use. So thank you very much.
Thank you.
I want to remind our audience that if you have any questions for Dr. Tariq, please put them in the chat or the Q&A, and we can then pose them to him. But I will start off with a couple of questions of my own. Since you started off with a focus on sleep, and as I agree with you completely, sleep is something that tends to be overlooked a lot. But you mentioned having experiences in your clinic where you have maybe adolescents coming in with disrupted sleep patterns, but also sleep patterns tend to vary by age, right? So the way adults sleep, their patterns are going to be different from children or adolescents. So can you touch a little bit about that, and also how sleep patterns may vary during the holy month of Ramadan, because there's a shift then?
Great question, Dr. Abraham. So you're right. So the sleep requirements varies across ages. The younger people need more hours in terms of duration compared to the older people. And there are data suggesting chronotype is important. So if they sleep early, outcomes are better than if they sleep late for 8, 9 hours. So let's say you have someone who needs 8 hours of sleep. If they sleep 8 hours starting at 1 a.m., this is worse than someone who sleep 8 hours starting at 9 or 10 p.m. So the chronotype is very important. What I see in my adolescent population is that their sleep is fragmented. When sleep is fragmented, the duration of REM sleep is short. So REM sleep is the effective part of sleep. The longer you sleep, the longer duration of sleep that you get. But when your sleep is fragmented, you're not getting the same benefit. So my advice to people who interact with adolescents is to try to make sure that they're sleeping enough and they're sleeping continuously. Taking a nap is not a bad thing, but a power nap is like a 30-minute power nap, not a 2, 3 hour nap.
Excellent. Thank you for that. And if you can also touch on in terms of how Ramadan sleep patterns might vary and how we can uh, get the most out of that.
Yeah. So again, like I think social factors play an important role. So many people during Ramadan change their sleep habits. It can be due to religious reasons. Let's say they're praying, they're practicing. But I think we should do our best to try to preserve the structure of sleep as much as possible. Again, Ramadan is a spiritual month, so many people may have interrupted sleep due to that reason, and I cannot make a recommendation for that. But the majority of people are disrupting their sleep for social reasons, and for these people, I strongly encourage them to try to stick to their sleep schedule. Maybe it's okay to delay it a few hours during Ramadan, but you still need the continuous sleep to get the benefit.
Excellent. Thank you for that. We have a question in the chat about the relationship or the connection between diabetes and sleep. If someone is diabetic, does that cause sleep problems? And specifically, is there a connection between diabetes and sleep apnea?
Yeah, that's a great question. So sleep apnea is very common in people with diabetes and people with obesity. So both obesity and type 2 diabetes are risk factors for sleep apnea. Sleep apnea is also underlooked. It's we don't screen for it as much as we should. And people who have sleep apnea may have catastrophic uh, complications. For example, many people get into car accidents um, because of sleep apnea. We can easily screen for it using questionnaire, the stop bang questionnaire. And then if the stop bang questionnaire is positive, then we take it to a sleep study. But yes, there is a strong association between diabetes and obesity, as well as obstructive sleep apnea.
Excellent. Thank you very much. Another question relating to sleep. Does taking a nap in the afternoon affect your blood sugar, short term or long term?
Um, as far as I remember, is that power nap is okay. The issue is when your sleep is fragmented and you take a long nap in the afternoon. I think this fragmentation is what contribute to the metabolic disruption in diabetes.
Okay, excellent. Thank you. Another question that's come in is regarding fasting for women who, how does fasting impact their hormonal balances during fasting? So, for example, let's say individuals who may be diabetic. Do you have any comments on that?
Sure, sure. So people with diabetes, again, like fasting can have different impact on health. People with diabetes, the main thing that we worry about is hypoglycemia, low sugar. So let's say I have someone who takes insulin and they plan to fast and they do it without getting advice from their physician. Then I worry that the insulin that they're taking as a medication may drop their sugar. So definitely people who take insulin, they will need adjustment to their insulin level. They will need close monitoring during fasting. With regard to women and other hormones, so let's say, yeah. So as I mentioned earlier, with fasting, if you're coupling fasting with caloric restriction, you may lose 5 to 10% of your total body weight. And women with polycystic ovarian syndrome, this 5 to 10% weight loss can have beneficial effect. The other thing that we may see with weight loss during the initial phase is that when you lose weight, there might be some irregularity in the menstrual cycle that will eventually normalize. So if this is the question, then we may see it during fasting with weight loss. It might be perceived as stress to the body initially. There might be some irregularity in the menstrual cycle, but it should regulate with time.
Okay. Also, a related question. Do we know anything in terms of how diabetes can influence menopause, or vice versa? Does menopause affect blood sugar levels in women who are diabetics?
Yeah. Um, yeah, I do one clinic once a month in Sidra, and a lot of my patients are women in the perimenopausal age. A lot of changes happen during that time. So when estrogen levels go down, there are many changes that happen at the level of the body composition, where you can have a decrease in lean mass and an increase in the fat mass that can lead to low level inflammation, maybe higher risk of insulin resistance and prediabetes. We don't see it in everyone, but these are factors that we take into consideration when we're evaluating a woman in the perimenopausal age. Lifestyle does make a big difference, by the way. There are data on this, and we see it in practice. So women who are experiencing perimenopausal symptoms, engaging in healthy lifestyle can have beneficial effect on their symptoms. So it all go back to the core component that we should do better at lifestyle.
Yes, exactly. So, um, basically, a sort of a multi-pronged approach
Mhm.
is the way to go when we're talking about these kinds of issues. Any comments or thoughts about um, the gut microbiome? So things such as fasting, for example. First of all, if you can just quickly speak about what the gut microbiome is, and if you're aware of any studies that of on the influence of fasting on the
Yeah,
microbiome.
exactly. I think there are some data on this. So in our gut, we have bacteria, and bacteria plays a role in our health in general. The- so there has been interest in this over the last 10, 15 years, and our gut microbiome composition has an impact on the manifestations of different diseases. We know the type of food has an impact on the microbiome. So this is how like uh, following a healthy diet can have an impact on microbiome. And there are some data that shows that fasting has a positive impact on the microbiome. What is the magnitude of benefit? I'm not sure, but I've come across a few studies that looked at microbiome composition, and it seems like there is a trend toward more beneficial composition.
Excellent. Good to know that. I know we are at time, but I see another question in the chat. Is it okay if you stick around for a couple more minutes, Dr.
Sure.
Tariq?
Of
Okay.
course.
So we have a question asking about high protein diets.
Mhm.
Are they beneficial in the long term, given someone is also engaging in all of the other components of lifestyle medicine? So physically active, getting regular sleep. Would you recommend high protein diets for people?
Yeah. It depends what we mean by high protein diet. So if someone is meeting the need, even like the newer guidelines for 2026, 2030, they're recommending a higher protein diet. So as long as it's coming from a lean protein diet and you're engaging in physical activity, and you're decreasing the amount of refined carbs, decreasing the amount of added sugar, it's probably beneficial. If you have a kidney condition, then you should talk to your kidney doctor. But otherwise, like if you're healthy, engaging in physical activity, and you're consuming a high protein diet, it is beneficial. Okay. There are
All right.
so we This is very important in my practice where I treat people with medications for weight management. When you lose weight, you lose both fat and muscle. Our goal is to try to lose more fat and preserve as much muscle as we can. There are two key components to preserve muscle mass. One of them is adequate protein intake. Two is resistance training. So it is an important component.
Okay. Excellent. I'm not seeing any more questions in the chat, so perhaps if you can sum up maybe two or three key takeaways you want our audience to leave the session with.
Sure. So we talked about metabolic health. The first thing that I started with is know what metabolic health. In the adult world, we typically refer to conditions that increases the risk, such as type 2 diabetes, hyperlipidemia, hypertension. If the goal is to prevent diseases, then the focus should be on healthy lifestyle. If someone has a specific disease related to metabolic health, then my advice is see a specialist in this field so that you can get a patient-centered approach to your treatment. And I'd like to end by thanking you, Amit, for this session, for facilitating this session, and thanking everyone for your engagement and for asking relevant questions.
Thank you very much, Dr. Tariq. We are very appreciative, and I'm also seeing a few appreciative comments in the chat. They were saying it was a very informative presentation and they really enjoyed it. So thank you for taking time out of your busy schedule to join us. We're very appreciative of that. So thank you, everyone, and please stay safe.
Thank you.
Bye bye.